Good day, everyone. For this week's topic, I will be discussing the first part of your outbreak management if there is any healthcare associated infections. Now, first thing that we're going to discuss on outbreak management is we need to know the epidemiology of infectious diseases. What do we mean by natural course of disease? As you can see on the slide, natural course of disease refers to the progression of a disease process in an individual over time in the absence of treatment. For example, untreated infection with HIV causes a spectrum of clinical problems beginning at the time of seroconversion or your primary HIV and terminating with AIDS and usually death. It is now recognized that it may take 10 years or more for AIDS to develop after seroconversion. Many, if not most, diseases have a characteristic natural history. Although the time frame and specific manifestations of disease may vary from individual to individual and are influenced by preventive and therapeutic measures. It is now recognized that it may take 10 years or more for AIDS to develop after seroconversion. Many, if not most, diseases have a characteristic natural history. Although the time frame and specific manifestations of disease may vary from individual to individual and are influenced by preventive and therapeutic measures. As you can see in the slide, the process begins with the appropriate exposure to or accumulation of factors sufficient for the disease process to begin in a susceptible host. For an infectious agent or for an infectious diseases, the exposure is a microorganism. For cancer, the exposure may be a factor that initiates the process, such as asbestos fibers or components in tobacco smoke for lung cancer, or one that promotes the process, such as estrogen for endometrial cancer. After the disease process has been triggered, pathological changes then occur without the individual being aware of them. This stage of subclinical disease, extending from the time of exposure to onset of disease symptom, is usually called as the incubation period for infectious diseases and the latency period for chronic diseases. During this stage, disease is said to be asymptomatic or inapparent. This period may be as brief as seconds for hypersensitivity and toxic reaction to as long as decades for certain chronic diseases. Even for a single disease, the characteristic incubation period has a range. For example, the typical incubation period of hepatitis A is as long as 7 weeks. Although disease is not apparent during the incubation period, some pathologic changes may be detectable with laboratory, radiographic, or other screening methods. Most screening programs attempt to identify the disease process during this phase of its natural history, since intervention at this early stage is likely to be more effective than treatment given after the disease has progressed and become symptomatic. The onset of symptoms marks the transition from subclinical to clinical disease. Most diagnoses are made during the stage of clinical disease. In some people, however, the disease process may never progress to clinically apparent illness. In others, the disease process may result in illness that ranges from mild to severe or even fatal. This range is called spectrum of disease. Ultimately, the disease process ends either in recovery, disability, or even death. For an infectious agent, when we talk about infectivity, this refers to the proportion of exposed persons who become infected, while pathogenicity refers to the proportion of infected individuals who develop clinically apparent disease. While your virulence, this refers to the proportion of clinically apparent cases that are severe or fatal. Pathogens affect all living organisms and cause illness to humans in a variety of ways. They can damage tissues or cells by producing toxins as they replicate. Now, we need to differentiate what is infection from colonization. Now, infection, these are what? It defines the entrance and development of an infectious agent in a human or animal body, whether or not it develops into a disease. Infection is the replication of organisms in host tissue which may cause disease, while your colonization, this is the presence of a microorganism on or in a host with growth and multiplication of the organism, but without interaction between host and organism, or meaning to say there's no clinical expression or no immune response. Infection may be clinical or subclinical and may not produce identifiable disease, while your colonization may or may not be a precursor of infection. It may be a form of carriage and is a potential source of transmission, that is your colonization. And we have commensal or normal flora. Those are microorganisms that is present in or on a body site without causing clinical infection. Those are your commensal or your normal flora. To further differentiate your infection and your colonization, infection is the presence of microorganisms causing damage to body tissues, usually in the presence of acute inflammation like your pain, swelling, redness, heat, and loss of function. And while your colonization, it describes when bacteria grow on body sites exposed to the environment without causing any infection. So it's just there. It doesn't cause you any inflammation or infection or any tissue damage. Now let's differentiate your case patient and a carrier person. It's just like a case patient is infection while your carrier is a colonization. So that's the difference between the two to make it more easier to understand. But a case patient is a person who have the pathogen multiplying, meaning to say he or she is infected, and meet the case definition of a specific disease. Like we have case definitions of your MERS-CoV and COVID. So those are a case patient if they meet the suspected case definitions. While your carrier, this is a person in whom organisms are present and may be multiplying, but who shows no clinical response to their presence. The carriers may be permanent, with the organisms always present. It could also be intermittent, with the organism present for various periods, or temporary, with carriage for only a brief period of time. And carriers, just like those who are colonized, may shed microorganisms during incubation period and during convalescence. Now let's try to define your infection and your disease. Okay? These are the timelines of your infection and disease. Infection-wise, we have your latent period and we have your infectious period. When I talk about latent period of an infectious disease, this is the time interval between exposure to infection and becoming infectious. Okay? That is your latent period. While infectious period, this is the time during which the host is infectious. That is infectious period as the term goes. While your incubation period, this is the time interval between infection and the appearance of your clinical symptoms. That is your incubation period. Infection and the appearance of your clinical symptoms. While latent period, this is infection and becoming infectious. Your symptomatic period under your disease-wise, this is the period in which symptoms of the disease are present. So, infection, you are infectious. Disease, there is the appearance of signs and symptoms, but sometimes it is not really infectious, depending on the case of your patient or the person. Now let's go now with your case definitions. When we talk about case definitions, this is a set of uniform criteria used to define a disease for surveillance purpose. I know that all of us have been hearing this word, case definitions, because we have case definitions for MERS-CoV and we also have case definitions for COVID. So these case definitions, these are how we are going to define suspected cases of a certain diseases. Aside from your MERS-CoV and COVID, we also have case definitions for your leptospirosis, Kawasaki diseases, your measles, in which we have different sets of criteria on how we are going to define such case or such infection. Case definition in an outbreak situation can be divided into three categories. The first category for our case definition is we have your suspected or possible case. Suspected, meaning to say there is presence of clinical signs and symptoms without epidemiological link or laboratory confirmation. So when the patient gets into our hospital and presented these kinds of clinical presentation or clinical signs and symptoms, then that is a probable, that is a suspected or a possible case of a certain infection or disease. The other one is we have your probable case. A probable case is a suspected case plus an epidemiological link. Okay? When I talk about epidemiological link, these are exposures. Let's say, for example, if you have been exposed to a certain or confirmed cases of MERS-CoV, COVID, or measles, if you have been exposed to places where there are positive cases or confirmed cases, if you have consumed to any products where those products are the main reservoir for certain infections, so that is your probable case. Now the last category is we have under your case definition is your confirmed case. So this is the last case definition, meaning to say the case is already confirmed based on laboratory analysis. Regardless if the patient has clinical signs and symptoms or if there is any epidemiological link or exposure, as long as it is confirmed by a laboratory procedure or analysis, then it is confirmed case already. Next is we have your index case. Index case, this is the first case among a number of similar cases that are epidemiologically related. Let's say, for example, if an eye doctor discovers a person has glaucoma and subsequently other cases of glaucoma are found in that person's family, that person is the index case. Other than that, an index case or a primary case is the initial patient in the population of an epidemiological investigation. The index case may indicate the source of the disease, the possible spread, and which reservoirs holds the disease in between outbreaks. The index case is the first patient that indicates the existence of an outbreak. And I think we can relate to this one when during the peak of the pandemic, your COVID-19, when we had one staff in the hospital, she was the first staff who was tested with COVID-19. Then suddenly all of us got panic and we tested everyone or those who came in contact with our index case. And unfortunately, many people or many staff have been infected with that certain disease or infection. Next is we have your case finding. Now, case finding, it is a method of identifying patients with healthcare-associated infections through a combination of reviewing medical records, asking questions directed to patients or healthcare workers, and checking laboratory imaging or other relevant data if available. Furthermore, when we talk about case finding, this is a strategy for targeting resources at individuals or groups who are suspected to be at risk for a particular disease, it involves actively searching systematically for at-risk people rather than waiting for them to present with symptoms or signs of active diseases. And case finding is also a key strategy in communicable disease outbreak management. The purpose is to identify at-risk individuals and offer them screening and treatment if necessary. Environmental sampling is the collection of samples from the healthcare environment or equipment rather than from humans that are cultured for microorganisms. Furthermore, when we talk about environmental sampling, it is an important tool to verify sources of contamination and adequacy of sanitation process. It would also help us to refine the frequency and intensity of cleaning and sanitation, identify hotspots, validate food safety programs, and provide an early warning of issues that may require corrective actions. Now let us discuss the levels of your disease occurrence. We have your sporadic level, endemic level, hyperendemic level, epidemic or your outbreak, and your pandemic level. Talking about your sporadic level, these are occasional cases occurring at irregular intervals. In sporadic level, the cases are so few, it could be in a single or in a cluster, and separated so widely in time and place that there exists little or no connection within them. They also do not show a recognizable common source of infection. Like we have your tetanus, rabies, and your plague. Those are just common examples of your sporadic diseases. Your endemic level, it refers to the constant presence and or usual prevalence of a disease or infectious agent in a population within a geographic area. Other definitions of your endemic level is it describes a disease that is present permanently in a region or population. Let's say, for example, there are some countries or regions that malaria is always present or is considered endemic in certain countries and region. Other examples of your endemic diseases is we have your influenza, malaria, and your HIV. So these diseases is constantly present in a population within a particular region. Next is we have your hyperendemic level. Hyperendemic is the persistent high levels of disease occurrence. Occasionally, the amount of disease in a community rises above the expected level. Next is we have your epidemic or your outbreak. When we talk about your epidemic, this refers to an increase, often it's sudden, in the number of cases of disease above what is normally expected in that population in that area. Outbreak also carries the same definition of your epidemic, but it is often used for a more limited geographic area. Now, epidemic, let's say for example, in a specific or in a certain time, the number of COVID-19 cases in a certain population or area is 1. And suddenly, it goes above what is really the normal number of cases. So that is an example of your epidemic. And lastly is we have your pandemic level. This refers to an epidemic that has spread over several countries or continents, usually affecting a large number of people. Just like our COVID-19, it became a pandemic because it has affected almost all of the countries or everyone in the world. Let's go now to your healthcare associated infection or your HAI. Your HAI, it is an infection that occurs in a patient as a result of care at a healthcare facility that was not present at the time of admission to the facility. To be considered an HAI, the infection must begin on or after the 3rd day of admission. The day of admission is day 1. So meaning to say if the patient developed any infection 3 days after after his admission to a unit or to a hospital, then that is considered as a hospital-acquired infection. But if the patient develop any signs of infection less than or from the first day he or she was admitted and until the second day or third day or within that period, he or she developed an infection, then that is considered as your community-acquired infections. After the third day of infection, the patient developed, after the third day of admission, then the patient developed any infection, then that is considered as your healthcare-associated infection. The term healthcare-associated infection replaces the formerly used nosocomial or hospital infection because evidence has shown that these infections can affect patients in any setting where they can receive healthcare. So they changed it from the previous name for this one is we have your nosocomial or your hospital-acquired infections because infections cannot only be acquired in a hospital but in any other setting also where healthcare is being delivered. As what I have mentioned, outbreak, it is the occurrence of a disease in a population above the normally expected rates at any given time or location. If the expected number of cases of a disease in a specific hospital is 8 per year and 16 occur in 1 year, this is considered as an epidemic. It should be noted that an epidemic is not defined on the absolute number of cases, but on the number of cases in comparison to what is expected. So let's say, for example, for how many years we've been, the number of cases for a certain disease or infection is this level only, 5, 5, 4, like that. And on the succeeding year, there was a sudden increase of the same infection or disease. So that is considered already as an epidemic or an outbreak. The healthcare-associated infection outbreak, it is an increase in the number of HAI events among patients or staff over and above the expected number of cases. However, for the sake of early detection, if there are more than 2 cases of HAI within the same organism linked to the same exposure at any given location within 3 days, it will be considered an outbreak. In some rare, emergent, and high-risk pathogens, one pathogen is enough to declare an outbreak, like your viral hemorrhagic fever or your Candida auris. Outbreaks in some healthcare facilities are often multifactorial, including breaches in infection control or clinical practice, contaminated devices, infected or colonized patients, and/or healthcare workers. Last slide for this part is we have your epidemiological triad. It is a model for depicting disease causation, and it consists of an external agent, a susceptible host, and an environment that brings the host and agent together. Now, your infectious agents, these are microorganisms that has the ability to cause disease, like your virus, your bacteria, parasites. So those are your infectious agents. Your susceptible hosts, these are person, or it could be anyone, but we have certain groups or categories of human or individuals that are really susceptible to infection or any diseases. So these are persons who cannot resist a microorganisms invading the body, multiplying and resulting to infection. The environment provides the mutual background in which agent-host interactions takes place and contains the factors that influence the spread of infection. Environmental factors include physical factors such as geology and climate, biological factors such as insects that transmit the agent, and socioeconomic factors such as crowding, sanitation, and the availability of health services. So that ends our lecture for the first half of the topic, Introduction to Epidemiology of Infectious Disease. And hopefully by next week, we can have the second part of the same topic or the same chapter regarding the introduction of your epidemiology of infectious disease. So thank you, and hopefully we can see each other on our next meeting. God bless.